Your patient has difficulty breathing, swollen legs, chest pain, and dizziness. What is the priority problem for this patient? Hello everyone, let's talk about pulmonary hypertension. We'll discuss what it is, why it happens, presenting signs and symptoms, treatment options, and the nursing interventions you must know. Pulmonary hypertension is not just high blood pressure in the lungs. It can affect the entire body due to the involvement of the right side of the heart because eventually the right ventricle begins to fail. What is pulmonary hypertension? In pulmonary hypertension, the pressure inside the pulmonary arteries becomes elevated. Pulmonary arteries carry blood from the right side of the heart to the lungs. When they become narrow or damaged, resistance to blood flow increases. And because of this, the right ventricle will need to compensate by pumping really hard to move blood forward. As the problem continues, the right ventricle weakens and fails, leading to right-sided heart failure caused by lung disease. What are the causes? Pulmonary hypertension may be primary, which means the cause is unknown, and it may be secondary to another condition. For the NCLEX, pulmonary hypertension may be caused by problems like COPD, pulmonary embolism, pulmonary fibrosis, and sleep apnea. Take a look at this practice question 1. Which of the following increases a patient's risk for pulmonary hypertension? Answer choice A, bronchioles, B, COPD, C, appendicitis, D, migraine headaches. Place your answer choice in the comment section. Nurses must be familiar with the signs and symptoms. Difficulty breathing is very common in patients with pulmonary hypertension. Their first presenting symptom is usually shortness of breath on exertion. As the disease worsens, they may experience dizziness, chest pain, syncope, edema, and cyanosis. Why do they have syncope? During activity, the failing right side of the heart cannot send enough blood to the lungs for oxygenation. Because of this, there is decreased cardiac output. The brain receives less oxygenated blood, and that's the reason for dizziness or fainting. Decreased cardiac output is the priority problem for this patient. The major complication of pulmonary hypertension is right-sided heart failure, so pay attention to the signs and symptoms. When the right ventricle fails, blood backs up into the systemic circulation. Watch for edema, jugular vein distension, liver enlargement, and fluid retention. Let's talk about the treatment. The goal of treatment is to reduce pulmonary pressure and improve oxygenation. Oxygen therapy is absolutely important. Medications like calcium channel blockers, PDE5 inhibitors, digoxin, and anticoagulants may be ordered. Diuretics also may be ordered to reduce fluid overload. Nurse interventions are put together to ensure we meet the goals of care. This patient can develop fatigue easily, so do nursing tasks and ADLs in a way to conserve energy. Monitor oxygen saturation closely and watch for worsening right-sided heart failure. Educate your patients. Smoking and respiratory infections will make pulmonary hypertension worse, so teach them about smoking cessation and how to prevent infections. Patients should avoid excessive exertion and they should receive their vaccines as recommended by their doctor. This is practice question 2. A patient with pulmonary hypertension is most likely to develop which complication first? Answer choice A, skin problems, B, right-sided heart failure, C, stroke, D, renal failure. Place your answer choice in the comment section. Thanks for watching and learning from this video. Subscribe, save this video, and don't forget to place your answer choices or any questions you may have in the comment section. See you next time.